I'm KEREN, and I'm a cardiologist working in the cardiomyopathy and heart failure fields in Hadassah University Hospital in Jerusalem and Assuta Hospitals in Tel Aviv. And I am really honored to participate in this important educational course at which I will give two lectures on somewhat different topics. One is related to the basic diagnostic approach to hypertrophic cardiomyopathy. How do I evaluate symptoms in hypertrophic cardiomyopathy, starting with anamnestics and history and family history, examination, and then smart use of the tests in an integrative way, laboratory and imaging tests particularly, in order to reach diagnosis in simple as well as in complex cases where perhaps only endomyocardial biopsy, heart catheterization and genetics can review the true etiology of the symptoms we have to evaluate. On the other hand, is the second lecture is on the topic of the athletic cardiomyopathy, because during the last years it became more and more clear that in general active athletes are living longer. At least by 30% they prolong their longevity as compared with inactive people. But it turns out that after a given point, actually when you go to extremes, physical activity can become detrimental. It's actually, the basic issue is that it's a U-shaped curve. Originally you decrease all the risk factors and detrimental factors in the body which shorten life, but then when you overdo it, then the physical athletic activity, particularly in the endurance sports, can become detrimental and shorten the life of the people. And what are the mechanisms and what are the true or the correct doses of physical activity? It is still an issue of discussion and research, but this approach now it's very seems to be well founded, and we have to make aware all these young physicians starting their careers here in these excellent educational sessions that physical activity might be also detrimental when it's overdone.